Hey everyone, welcome to the answer session of this week's Ask Dr. Dan. Again, this week we were talking about the EmSculpt NEO, which is the most advanced non-surgical technology for both fat loss and muscle gain. We are also really excited to announce that we are going to be the first practice in the entire state of New Jersey to have the EmSculpt NEO. So with that, let's get to the questions. So the first question is, how long until you see results? It takes time. You might notice some changes pretty quickly. You will notice strength in the abdomen, sometimes even during the course of treatment. But we tell people it takes about 6 to 12 weeks to get the full results because that muscle has to build, and then the body also has to get rid of the fat. So what those treatments are doing is just setting off the process, and then your body has to do the rest of that work. So it does take a little bit of time, but after 6 to 12 weeks, the results are there. And the second question is, do I still have to diet and exercise? And the answer to that is absolutely. So if you have a poor diet and you gain weight through the process, you're not going to see your results. So now that muscle gain will still be there, but it'll be surrounded by fat. So you're not going to get the aesthetic look that you're looking for. And also, exercise as well. You still want to stay strong and you want to stay on a regular exercise program, and that will only boost your results. So what they found with the studies on the NEO is that it was basically the equivalent of working out for about 12 weeks. Now, when you combine that with exercise, you're only going to amplify those results. So you'll get even more muscle and you'll get even more fat loss. So it's definitely worth sticking on a good diet and exercise program if you're going to do a treatment like this. Number 3, so how does this compare to CoolSculpting and other fat loss machines? The quick answer is it's superior to all of them, but specifically with CoolSculpting, it's an older technology. It's using cold technology. There are some complications, potential for things like frostbite or even what they call shark bites, where the fat leaves a bite mark there almost. The other thing with CoolSculpting is it's very small sections that can be treated, so you have to do a lot of different areas even if you're just going to do the abdomen, so that takes a lot of time and it's very expensive. As far as the results go, CoolSculpting shows an average of 22% fat loss, where again the EmSculpt NEO shows an average of 30% fat loss. So you're talking about almost 50% more fat loss, and CoolSculpting does absolutely nothing for the muscle. So you're getting that 25% muscle growth as well. That's probably the most competitive, the biggest competitor to the EmSculpt, and as you can see, it's not even close. So the other machines are nowhere near that. Number 4, so how long is each treatment and how often? So very similar to the EmSculpt, each treatment for the abdomen and the butt is 30 minutes. For the arms, it's 20 minutes for the bicep and 20 minutes for the tricep, so a 40-minute treatment, and for the calves, it's 20 minutes as well. The difference is that where the EmSculpt you're doing twice a week, the EmSculpt NEO you're doing once every 7 to 10 days. And the reason for that is the radiofrequency. So you have to kind of let that tissue heal a little bit, and then you get back into the radiofrequency. So the radiofrequency just extends the time in between treatments, but still it's the same amount of time per treatment. Number 5, will this tighten skin? The answer is absolutely. It is not an indication that they have yet, but what is the treatment for most skin tightening procedures? It's radiofrequency. So it only makes sense that it's going to tighten the skin. So you're going to get fat loss, muscle gain, and skin tightening, and probably even in areas of cellulite, you're going to get reduction in that too, because a lot of those machines are also based on radiofrequency. So you're basically addressing everything all at once on one machine. So the time to get all these treatments is much, much less, and the cost is going to be much less because you're doing it in one machine instead of doing like 3 or 4 different types of treatments. Now, sometimes something like the M-tone, for specifically if there's a pocket of cellulite after something like that, you could use to clean up, but this will probably do a really good job on that. Number 6, so what body parts can be treated? So it is the exact same areas as the regular EmSculpt. So you have the abdomen, you have the butt, the arms, so both the biceps and the tricep area, and you have the calves. Off-label, you could try things like the thighs and the love handles as well, although there are other treatments that can be used for that too. The arms are going to be out in early spring, so that's going to take a little bit longer, but that will be there. And then the last question, is there any recovery? And the answer is no. So you can walk off the table and you can go right about your day. The only thing I would say is, just like with the regular EmSculpt, if you did something like an abdominal workout the same day right after you did the EmSculpt, you just did 20,000 crunches, you're going to feel a little fatigued. But what's great about the technology is it also factors in a rest phase that helps get all the lactic acid out that it built up with all those crunches. So you're not even crippling sore afterwards. You know, if you did 20,000 crunches on your own for the next few days, you'd be shot. It's not like that with this machine. So yeah, so there's no recovery at all. You could just go back about your day. And that's it. So those are all the questions for this week. Again, don't forget to follow us on all our social media, on Instagram at RegenerateNJ, on Facebook and YouTube at Apex Center for Regenerative Medicine. And if you have any other questions, we'd be happy to take them. We will not have an Ask Dr. Dan next week, but we will see you in 2 weeks. So have a great week, and remember, don't operate, regenerate.